Hi, this is Dr. Jim Anderson from Anderson Center for Regenerative Medicine, and I'm here to talk to you about the idea of regenerative medicine. I want to keep this in kind of a higher level discussion. I don't want to go into too much detail into biochemistry and exactly how all this works. But I'm excited to let you know that we are now providing more services in regards to regenerative medicine. We have recently brought along a doctor named Dr. Darby, who is an MD, and she is now our medical director. So what that means to you is we are now able to provide these services to other areas, namely the shoulder and particularly the knee. Lots of you are suffering from arthritis of your knee. Many of you have considered the option of knee replacement surgery. And as a surgeon, I think at some point there may be, that's a good thing to consider. But why not consider first the option of stem cell? And as time marches on, I think knee replacement and technology can get even better. So in a way, you're maybe even kind of buying yourself some time. So anyway, my story with regenerative medicine really goes back probably about 8 years ago. And at that point, in the Rocky Mountain area, I was the first foot and ankle surgeon to really provide this service. We started out primarily with plantar fascia pain, which is heel pain. It's very common to have heel pain on the bottom of your heel, and this is commonly called plantar fasciitis. And back then what we were doing, we would draw your blood, the patient's blood, and our nurses in our surgical center would then process it. Took about 20 minutes to process. Then we'd be using your cells, your body's stem cells. And what that simply means, they're sort of the master cells. They're the cells that can differentiate or change into bone cells or tendon cells, or in this case, fascia cells to repair the plantar fascia. And that's what we were doing. And we were really getting some pretty good results. We still do. So that's where it started though. And then we started doing it on joints in the foot and ankle, and then also on tendons. If somebody had a minor tear, many times we could avoid a surgery by doing this. And that's what excited us, because with the right application, right problem, you can usually avoid surgery in many cases, and worst case scenario, at least extend the time that you would have to do the surgery. So very important, and I think it's a great service, and that's what motivated me to integrate our practice. And by having Dr. Darby here, it allows us now to do other joints, such as the shoulder, such as the knee, and this is something that we're really excited to share with you. And so as time has gone on, probably about 3 years ago, we went from doing what's called PRP, or it's called platelet-enriched plasma, which is your body cells. We went to what we feel is a better kind of product. It's called AmnioFix, and AmnioFix is derived from the placenta. A couple layers of the placenta are processed. Mothers go full term. It's important that you understand that. This is regulated by the FDA. It's approved by them. It's regulated by them, and they go full term, and they have a C-section, and they're asked if they want to donate the placenta. Then that goes to a lab. It's again very highly regulated. There's never been any reported side effects from this, and then this is what we have, and that is used. It's injected into the joint, it's injected, the tendon, plantar fascia, whatever. So that's what we've gone to, because we think it's better quality, younger cells, if you will, than your cells, okay? And they have more potential for repair. And more recently, I want to add that we have started using umbilical cord stem cell. This is, I consider, very high grade. It's got a lot more stem cells in it. And particularly on knee and shoulders, we're using this more. And there are very few clinics really that offer this. There may be as few as 5% of clinics that you might be hearing about that do regenerative medicine that are using umbilical cord. So hopefully, I think we're on the cutting edge, and this is even going to be have better outcomes than the other two products potentially. So I think that's important to note. And regenerative medicine is very exciting. I think you have to kind of switch the way you're thinking, because as you're watching this video, or as the days and weeks go by, we're all kind of degenerating, and it really accelerates as you get older, especially over 40 and 50 and 60. It does accelerate quite a bit. So think of it in those terms. We can actually take whatever's ailing you right now and actually kind of set you back in time, if you will, to where you weren't as symptomatic, get you back to doing what you want to do, and hopefully avoid a surgery for you. So We're excited to introduce this concept to you, and please go to our website. We have a newer area there that we just completed, and on that website you can see different areas of the body. Click on it and learn more about what we can potentially do for you in those specific areas. So thanks for watching, and I hope that was informative.